Dr. Manasco. My name is Kelsey Dams. If you could just do a quick little introduction of yourself.
I'm Dr. Manasco. I teach here at the W. I'm a professor in the Department of Speech Language Pathology. I teach anatomy and I teach some of the brain type classes.
All right. So within the discipline of speech language pathology, what does your research look like?
Well, it varies a good bit. Um, During COVID, I had to transition into looking at the impact of um, COVID isolation procedures on patients with Alzheimer's in nursing homes, and
Hmm.
also the impact of those protocols on the professionals themselves. Let me see, recently we've been doing a pilot study on looking at a certain kind of speech therapy for a patient that has lost ability to find and produce his words as a result of stroke.
Okay. So is this a research project that you're currently working on?
Yeah, well, we've wrapped up sort of the initial stages and the results were positive. So we're going to probably extend it.
Okay. Is this a research project that you would be interested in having like a student assistant on?
It's possible. It's basically it involves therapy, delivering therapy to patients. Usually it's the master's level clinicians, the master's level students that are delivering the therapy. So they're usually more directly involved. But I also usually have an opening for an undergrad that wants to sort of run back up and just sort of be a helper and start learning the ropes of, how research works, how you get it started, how to
Right.
write a poster, how you present a poster, that kind of stuff.
So that kind of leads into my next question. Why do you think undergraduate research is so important?
Well, undergraduate research is important because we need graduate researchers and we need professional researchers. And you're if you if you've done some undergraduate research, or at least you've been started on that path in some way as an undergraduate, you're much more likely, I think, to pursue it at the graduate level and end up in a profession where you're doing more research or, for instance, being a professor.
Did you personally participate in research as an undergraduate? And if so, what were some of the main skills that you got from that?
I did not.
Oh, okay.
I was asked to, but I played in rock bands and I was doing a lot of touring. So I didn't have the time to do it at that moment, but I regret it. And it would have made because I ended up transitioning into a doctoral program for my PhD, which it would have helped me get into more doctoral programs probably if I had had more research on my resume.
Mm. Part-time rock star got in the way.
Yep.
Um, so have you recently worked with any undergraduate students on research, like in the past year or so?
I don't believe so.
Okay.
I think all my recent stuff has been with graduate students.
Okay. Well, then I guess thinking about your graduate students and how you work with them, how would you describe your mentoring style?
Well, I mean, doing what I do, uh, first of all, if you're talking about the student, graduate or undergraduate that is coming on to help me with my project, then you're going to be you're not going to be granted a lot of autonomy, because I understand that students don't know much about how things go. And on top of that, if this is a project where you're interacting with patients, then you're not going to be granted a lot of autonomy anyway because of that, even if you're a grad student. So there's, I would say probably most professors guiding students at any level, even at the level of a doctoral level student, there's a lot of guidance that has to happen,
Right.
because you're not how to structure a research project, how to put that into practice, how to get clearance from the university. These
Mhm.
aren't things that you learn at any other point, except when you engage in a professor for that purpose.
Right. Um, so do you have any advice for students who are interested in starting an independent research project?
Yes, and that is the most important thing is to probably think, at least with the students I work with, and in this particular field, there's what you think you can accomplish, there's your idea for the research project, and you think you can get it done in a year, but in reality, like when you're a student and you're thinking, oh, I can do this, that's what you're envisioning is probably like 10 years of research, right? So I'd
Right.
say take what you want to, what you think you want to accomplish, and probably dial that back by like 90% and focus on a much smaller version of that, because you don't realize it. But like, let's say you have a year to get your research done. Well, it's going to take probably one semester, or at least a good bit of one semester, just to get up the proposal written up for what you want to do and to get clearance from the IRB for you to even start doing that.
Hmm.
And then if you're doing something where you're involving participants, um, if those participants need to have a certain disorder, like they usually do in the kind of research I do, then how long is it going to take you to find those people? It's probably going to take you a while just to find them and run them and get your data. So what you think is possible, is when you start taking into account the realities of the world, at least when you're working with disordered and diseased and populations, it's a fight. It's usually, the students come in and that they have this great idea. And I'm like, well,
Right.
that's great. That sounds great for when you go for your PhD. I was like, that'll be when you do that. But for now, take that and like try to downscale it, because what do you have? A year, maybe a year and a half, probably at the most, depending on when you start. Uh, so you don't have a lot of time.
True. I
And the
feel like,
main thing is, especially if it's like a project that needs to be completed for graduation to
mhm,
happen, if it's an honors project or something, or a thesis, then the main thing is just accomplishing the research and being able to get it done.
yeah, that makes sense. Well, thank you so much for joining me for this.
Mhm.
As I told you, it was going to go by quickly. Do you have anything else to add before we go?
No, I don't believe so.
Okay, thank you so much.
Yes, ma'am.
Have a good day.
You too.